Welcome, everyone. Welcome, everyone. I'm Stephanie Pearson, Chair of the Environmental Issues Committee of the League of Women Voters of Broward County, and we welcome you all to our program. The League of Women Voters is a nonpartisan organization that never supports candidates or parties. We do, however, take positions on issues that we have studied and reached member agreements. Although we have positions on supporting public health, we do not have a position specific to adding fluoride to the public water supply because we've never studied it. Part of the mission of the League is to help inform voters on issues of importance, which is the reason for our program tonight. This program is to provide information on a subject much in the news. We have just 1 hour tonight, but we know the conversation will continue. This meeting is being recorded and will be posted on our YouTube channel. Following our presentation, our speaker will address questions in the chat. Please put your questions in the chat anytime. Due to time constraints, the chat will be visible only to our hosts, who will try to make the most of the time allowed by grouping them and ensuring that we have as many of the important concerns addressed as possible. Our presenter is Dr. Johnny Johnson, who is a pediatric dentist and is the co-founder and president of the American Fluoridation Society. He received his dental training from the University of Florida and earned his certificate in pediatric dentistry and a Master of Science degree from the University of North Carolina at Chapel Hill. He was a key source of information for the reporters and editors who helped the Tampa Bay Times win a Pulitzer Prize for its coverage of the fluoridation issue. Thank you for joining us tonight, Dr. Johnson. And you can, you're muted.
There you go.
Go ahead. Okay.
Thank you for having me tonight. I really appreciate the opportunity to speak with you and share some information. So I welcome questions at the end, and I will be happy to share what we know. There's a whole lot of information going on, a whole lot of moving parts going on at the national scene right now, as well as state scene here in our my home state of Florida. And fluoridation is at the center of a bunch of this right now. So the history or the future of water fluoridation, we're not sure where it's going to go, but we know what it does. And I'll walk through the history of water fluoridation, where we found out about it, the health issues, with risk and benefits, and what the evidence-based science shows. There we go. Let's go through an overview of water fluoridation first. Fluoride is a naturally occurring mineral in the Earth's surface, 13th most abundant mineral in the Earth's crust. Surface waters have a small amount of it in it. Groundwaters, wells can have anywhere from almost negligible amounts all the way up to, in some western states, over to 20 parts per million in the water from fluoride. It occurs when water comes through the aquifer up to the surface, that it erodes rocks that are rich in fluoride minerals, and that mineral gets picked up. So it's however much gets eroded away, it's with the fluoride level that's in that water. The ocean contains anywhere between 0.8 and 1.4 parts per million. The timeline of fluoridation is pretty interesting. A German doctor in 1874 was working with an animal model, and discovered that fluoride helps protect the tooth enamel of that animal. Of course, we didn't have internet back then, so we did not know that at the time. We had a dentist that did move out to Colorado Springs in 1901, and what he found was that his patients that had been born there or were brought in as infants, they showed up with brown stains on their permanent teeth when they came in, something he'd never seen before. He began to look at it and study it more, and he started to notice that these patients did not have hardly any cavities. And if you can imagine 1901, that was pretty unusual. They had brown stains, but almost no cavities. Speed along here a little bit. Public Health Service came out to investigate with him, and they decided, the only common denominator was everybody drank the water. They tested it, nothing unusual showed up. They began looking at other communities across the U.S., and there were areas where there were very few cavities and good-looking teeth. If anything, we, as dentists, we would see when we dried the teeth off little white marks on the teeth, something that just wasn't visible walking down the street to anyone else. Again, tested the water, did not know what it was because everything tested fine. Well, a fluoride probe to measure fluoride wasn't invented until 1930. And so water was sent to the chemist to test the water from Colorado and also from a city that had great looking teeth and almost no cavities. And it was discovered that fluoride in Colorado was very high, 2 to 12 parts per million. And in the areas where it was good looking teeth and very few cavities, 1 part per million. So a study was undertaken in 1945 to actually, all water has some fluoride in it naturally at some level. So what 2 cities did to start with is they both had fluoride in their water. Grand Rapids was one that they adjusted their level up to the 1 part per million, which was found quite by accident, but a wonderful finding. The other community did not adjust their fluoride levels. Within a few years in these cities that had adjusted it, cavity rates began to fall about 50, 60, 70%. So it was we had replicated Mother Nature, and it was something that began going further and further and has now expanded to well over 200 million people across the U.S. Also on my birth year, 1956, Crest brought on a fluoridated toothpaste onto the market, which was also a wonderful way to help prevent cavities. This is what the brown stain looks like. It's called Colorado brown stain back then. It's become known as dental fluorosis, modeling of the teeth. But the new term that came up along the way was dental fluorosis. The CDC still has part of their website up, even though their whole division was wiped out last week, or health division. The timeline link there will take you to the history of water fluoridation, much more thorough than I went through. Community water fluoridation is the adjustment of the natural fluoride levels in the water up to an optimal amount, which is considered the sweet spot for stopping cavities at their maximum, which is an average of 25% for adults and children. And at that level is 0.7 milligrams per liter or parts per million. Also, I said there's areas where it's naturally occurring very high, much higher than this. Those levels are reduced down to levels that are accepted, that are considered acceptable for serving drinking water. Oral health is huge. We look at a tooth with a cavity as a tooth with a cavity. It's far more than that. Dental disease, dental cavities, is the most common chronic disease of adults and children in the U.S. and around the world. The most common chronic disease, more common than obesity, diabetes, and asthma. It is an infectious and transmissible disease. But just think about that. When we talk about getting rid of chronic diseases right now, you're hearing diabetes and obesity. And yes, we need to get rid of those. But dental decay is the most common one. Children and adults suffer with toothaches. If you've ever had one, and I have, it's not something that you want to go through. It is a predictor in kids when you have cavities of how they're going to be as adults. You're more cavity prone. It causes us time away from school because of pain. It's very costly to treat. And it also makes it difficult to concentrate when you have pain for any reason. Pain is a powerful blocker of thoughts. This young lady here on the left actually has an abscess tooth on her upper jaw, and her eye is closing. The swelling is where the infection has now invaded into her facial planes. She could end up with an orbital around her eye infection, an infection that goes into her brain. She could be septic in a short time. She could die of an abscess, brain abscess, and on. Your entire body gets affected by it. It is a hazard and danger to our entire body. These are actually a couple people who died from it, and this is only a tip of the iceberg. If you looked at a toe tag on people that have died of cardiac arrest or have died of lung collapse and pulmonary collapse, many of those people will have an abscess tooth, third or fourth thing down. And that was what led to the issue of the person dying. Cavities affect everyone, no matter what age we are, how much money we make, our level of education, or our access to a dentist. Everybody gets affected. Low-income kids get twice as many cavities as those that are not living impoverished. In Broward County, you have nearly 250,000 people that live in poverty. Now, fluoride works in two separate ways. It works both by coating your teeth on the top of your tooth, that's through water, through toothpaste, through fluoride mouth rinses, coating your teeth on the outside surface. That's called its primary mode of action. It also works in a secondary mode, and that is when we swallow fluoridated water, it gets into our developing teeth of children, the permanent teeth below the gum line. And as you can see on the upper left picture, the teeth that are touching together are the baby teeth. The ones that are developing below the jaw where there's cutaways, those are the permanent teeth. Under the age of 8, those teeth are forming, the crowns of the teeth, the enamel, is getting fluoride incorporated into the structure of the tooth, making it more resistant to cavities than you would see if it was not present. So it's more resistant to cavities to begin with. They come in with a better opportunity to fight off cavities, and the chewing surfaces of those teeth are much more resistant to cavities because they have fluoride in them during development. You do not get that afterwards. It's low levels of fluoride in our mouths that are continuously bathing our teeth is what helps us to have the maximum benefits of cavity reductions. You'll sometimes hear people say, if I have a fluoride toothpaste, do I still need to drink fluoridated water? And the answer is yes. Fluoride toothpaste, as I said, just like fluoridated water, is coating your teeth. Fluoridated toothpaste, it is a much higher concentration of fluoride than what's in the water, but it only lasts for about 2 hours. So it puts a high amount of fluoride into your mouth for about 2 hours, and then the levels fall back to where they were before the fluoridated toothpaste was used. We don't like you to have plaque on your teeth because that's what helps with the bacteria in it. When we eat something that the bacteria lives on, it produces acid, and that acid is what dissolves the tooth. That's a cavity in the tooth. What happens is that between the plaque on our teeth and the tooth surface, there is a fluoride reservoir there. Plaque is maybe not the smartest thing in the world. It takes fluoride and it sucks it through itself, puts it next to the tooth. So when there is an attack on the tooth of acid, there's fluoride there to help repair that tooth and make it fluorapatite, a crystal that's harder and more resistant to another acid attack. Both are needed. Just like when airbags came out, we didn't stop wearing seatbelts. They're complementary. They add and work together. Are there any good alternatives to water fluoridation? No, there are not. It is the single most cost-effective way to prevent cavities for adults and children. Toothpaste, as I said, is not a replacement. They are both complementary. We need both. Fluoridated toothpaste will reduce cavities by about 25%. When you add fluoridated water onto that, you will get a further 25% reduction in cavities. And I will tell you, as a practicing dentist for 40 years, you will get cavity reductions in the neighborhood of 50, 60, 70% easily. Some will say you can use supplements. If you want fluoride, you can use a fluoride supplement and just put it in your water and mix it up for yourself. Fluoride supplements are for kids, and they are for kids that is during this time of tooth development up to the age of 16, because you may be developing wisdom teeth that you'll keep. Compliance is an awful issue. Getting the money to buy them, getting the transportation to go get them. If you've ever had to do this, you have to make sure that the children get them every day, and you have to make sure they chew them up, not drop it below their bed or in the couch, and that they take it every single day and swallow it. It does not benefit adults whatsoever, so it is not a replacement. Research has shown that fluoridated water is necessary for permanent tooth development to be more resistant to decay, cavities. As I said, on the chewing surfaces especially, which is the most common place for cavities to occur these days. When you have fluoride being incorporated into the teeth before they come in, the chewing surface is much more resistant to cavities because of having that during development. You do not get that after the teeth come in. Topical fluoride cannot give you that. Fluoridation is so easy. It gets to everyone in the community in the same amount of fluoride to everyone in the right amounts on a daily basis. You don't have to change a single thing that you do. You have fluoridated water at your place of living, at school, you're benefiting from it just by having it. It's one of the greatest tools in our toolkit. It stops, again, like I said, 50, 60% of cavities, somewhere in that range. Well, the flip side is you're still going to get 50 to 40% cavities. It's not the only thing. We want you to eat a great diet. We want you to have regular checkups. We want you to have good oral hygiene, dental sealants. When you look at half of this country does not go to the dentist every year. Half. Fluoridation sometimes is the only thing that's going to keep them from getting cavities, like during COVID. There was no other prevention out there that you could go to the dental office and get fluoride applied to the teeth. It was the one thing that kept us protected to a great degree by having fluoridated water. We have a tradition of fortifying foods in this country to help keep us healthier. Folic acid is one that we have in our breads and cereals that is federally mandated, and that is to help prevent neural tube defects, spina bifida. Fluoride is also something that is added to the water. It's already there. We're adjusting it to a level either up or down that is an optimal amount to help us get maximum cavity reductions. How do we know that water fluoridation is still a key form of prevention? Well, I'm sitting here right now, my mouth is dry as can be. I have receding gums because of all the medications I'm on. My mouth is just dry. I'm at a much higher risk of getting cavities around the crowns of my teeth because I don't have fluoride in my water where I live. I'm using a prescription fluoride. There's no replacement. That's constant bathing of fluoridated water as we get older, as well as those who are elderly living in facilities where they cannot take care of their teeth, young children, adults, all of us benefit. And again, as I said, for some that never get to go to the dentist, especially those that are the lowest income families, this is the only prevention that they may ever receive in dental care. When we look at the impact of fluoride in water and toothpaste, remember I said in 1956 toothpaste came on the market. Well, this first chart shows that in 1957 to 58, there were about 38% of adults had dentures. They were actually totally missing teeth, 38%. Now, in 2009, 2012, only 6% are missing teeth and needing dentures. That is a huge reduction, and that came from fluoridated toothpaste and fluoridated water combined. Other countries, it bears this out as well. The average number of decayed teeth in Brazil, those that have most of their lives lived in a fluoridated community versus non-fluoridated community, a major difference in the number of cavities that have decayed teeth. Same in England. You have a better lifestyle and quality of life when you have teeth, and fluoridation helps that. I might also add that England now has began to expand fluoridation. They've taken it to their federal level, and it no longer has to be decided in communities like it is in the United States. And it's a much better way to handle things. We will see England we're no longer going to be making fun of their teeth in a few years. I'm afraid they may be making fun of our teeth if the current trends continue. I will tell you how much we know about how fluoridated water helps. There are two cities that were studied. This has happened around in other countries as well, but two that I will show you were Edmonton and Calgary, Alberta, Canada. They are 90 miles apart. Both are fluoridated. In 2011, Calgary City Council decided we're not going to do it anymore. It was based on information that they received from opponents of fluoridation. It was not science. What happened is a researcher was looking at the data from kids in second grade in Calgary and in Edmonton. And she was making those measurements ever since 2004, 2005. When Calgary ended fluoridation in 2011, the people in Calgary actually began brushing even more diligently with fluoridated toothpaste. As you can see, Edmonton's cavity rates went from 55% up a little bit back and then back down in 2018, 2019, when fluoridation in Calgary went from a lower amount in the start of this was around 48%. They ended up at 65%. Edmonton was fluoridated. Calgary stopped. It shot up. That was in 2018, 2019. They're just getting ready to turn fluoridation back on. I asked a colleague of mine, is Dr. McLaren going to do a study again to show where it's at now? Because that was a rise that was going on. And she is not. And the reason she's not is that she was so threatened by opponents of fluoridation for her study that they scared her away. She does not want to touch it again. And that is true for many researchers. They have been threatened, they have been scared, they have been harassed, and they do not want to do fluoride research anymore. That is not acceptable. When we have to treat kids with severe cavities, as was happening in Calgary, we got to put them under. If you've ever been around something like this, and as a pediatric dentist, having to take a child out of a parent's arms because they can't cooperate in the chair, or there's a language barrier, or they have special needs and they can't handle sitting still in a chair to have dental care, we have to put them under in an operating room. That's scary. We know that some people don't wake back up from that. So this is something that we want to avoid. I will tell you that water operators prevent more cavities than all dentists combined can ever do simply by fluoridating the water. And that is a fact. And that's why it's so important to let our water operators know how big of an impact they're making on public health. When they find that out, they shine. They're very proud of it. Some don't want it until they do find that out. And then they're totally behind fluoridation. Here's what happened with general anesthesia during that same period in Calgary versus Edmonton. It went from a low amount, they were very similar. Now, the time 7 years was up, Calgary had shot up 78% from where it started in hospitalizations for dental treatment. Calgary stayed pretty much where it was, about 13%, a little bit of a rise. We're going to see with any disease, rises and falls in how a disease pattern goes. But this is a clear change just by the stopping of water fluoridation. No one can tell you that water fluoridation doesn't work. It absolutely does. Calgary has voted, like I said, to put it back in. Israel has stopped because a health minister was opposed to fluoridation in 2014, 2013. The next health minister came in 10 months later, said, we're starting it back. They're still going through the motions. They have to go through legal courts to get it. Then the COVID came along. Now there's a war. They're getting close to restarting. How does fluoridation affect the health cost of families and taxpayers? This is something that people don't necessarily think. We know from studies that the cost that a person saves in their pocket from having fluoridated water, these are 2013 numbers, is $32 per person per year is saved in dental treatment costs by having fluoridated water. That number is now $43, inflation adjusted. A study in Texas showed that it saved the Medicaid program $24 per child per year. Louisiana, $36 per child in 1 year's time. There's many of these studies. In Broward County, your families having fluoridated water save over $62 million in treatment costs, for dental treatment costs every single year. Because they have fluoridated water. One single tooth with a cavity, one single permanent tooth with a cavity costs over your lifetime over $6,000. I can show you my teeth. My teeth are about way more than that because the filling has to be replaced. The cavity starts under it. You have to replace it again. You get to big enough size. You have to go to a crown, maybe a root canal. You may have a tooth that's badly broken down enough, like one of my front ones, where if I lose it, I'm going to have an implant and another crown. it's extremely expensive. Prevention is king. Now, what concerns have been raised about fluoridation, water fluoridation safety? There was a study published in 2019 that many have heard about. It was one of several that had been published. This one was in the Journal of American Medical Association Pediatrics. And this researcher, Rivka Gring, excuse me, let me get a drink of water. She and her colleagues published a study that said there was an association between maternal fluoride exposure during pregnancy and IQ scores in offspring in Canada. Now, that's pretty concerning. JAMA Pediatrics is a reputable journal. Here's some issues with it, and I'll go through these in a minute. But one of the biggest issues is researchers are supposed to share their data so others can replicate it. They can see it and replicate the type of study that was done and show the validity in that study. These researchers have never released their data. 30 researchers from around the world wrote to the National Institutes of Health who funded this research and other research out of Canada and now out of California, and they said, we would like to see it. We would like to have this so we can repeat it, or at least look at the data and see if we agree with it. Because once a study gets out of peer review by a journal, it gets into the scientific world of peer review. That's where the rubber meets the road. This study has been widely criticized, not the analysis that was done by a fantastic researcher looking at the fluoride in the urine, but the study design absolutely was something that has not been done before and is widely criticized as not being appropriate. A paper was written by a group of folks in Canada and one from England about these studies. They used a biobank of tissues. In Canada, it was called MyRic. And they said that the flawed MyRic, fluoride, and intelligent quotient publications were basically a failed attempt to undermine community water fluoridation. Andrew Rugg-Gunn is a researcher in England, and he's an expert on analysis of fluoride. And he went through and read the NTP meta-analysis as well as the report. And one of the glaring issues was, and I will read this, Dr. Kyla Taylor, who wrote the meta-analysis that was just published late last year, she says that studies using an individual's pregnant mother's individual's one single spot urine sample in first trimester, second trimester, and third trimester, she was saying that basically it's more precise for an individual level than it is at a group level. And that's totally wrong. It's totally incorrect. She referenced Dr. Rugg-Gunn's study and another person's study. In those studies, and this is on the left here, Dr. Rugg-Gunn said spot samples, one single one from one time during the day in the morning, not 24, not one every hour. It was one spot sample. One spot sample of urine is even a poorer predictor of fluoride intake than 24-hour urinary excretion, and it is unsuitable for predicting fluoride intake of individuals. However, some of these studies, as well as the NTP, have totally misquoted that. And it is absolutely one reason why these studies are severely flawed. There are many. A group that is out of England that are known for high quality evaluations of studies came out with a statement last year. There was a review, a systematic review like the NTP has done, and the gentleman's name is, his last name is Taher, and his evaluation of studies was the same as the NTP review. And what they said was they got it totally backwards. The NTP and so did Taher. What they rated as high quality studies and low risk of bias is absolutely incorrect. They are low quality studies with high risk of bias. They further stated that that biobank in Canada is not designed to evaluate fluoride. Is not. They're not the only ones that have said this. Scientific panels from around the world have looked at fluoride levels, water fluoridation or fluoride in the water at natural levels of water fluoridation. And this is something that some countries do by law. Ireland has to do it by law. They don't look at benefits, they only look at harms. This is just a few of these groups. Every one of them says there is no health effects whatsoever from fluoride in water at levels of water fluoridation. Not a single one, including IQ, which Cadith and the one above it, the Royal Society of New Zealand, which came out late in 2024 and included the latest research out of out of California. They said, no, it doesn't apply. The court case doesn't apply. The Cochrane review does not apply. None of these things are changing what the facts are about fluoridation. Fluoridation remains safe and it is effective. A summary table was put together looking at studies that have been done around the world. The first set is by Jonathan Broadbent. He had children that he recruited at a young age that were in fluoridated and non-fluoridated communities. And they did IQ measurements several times at a young age. This was a 35 to 38 year study. He measured those same people again at age 38. You can see at a young age their IQ levels, because I'm a Gator, it's not why it's orange and blue. I am very proud. Go Gators. We won the national championship. But the IQ levels, the bars on the left, were essentially the same between fluoridated and non-fluoridated. At age 38, again, very, very little difference. Now, the study I just spoke about in Canada, where they said they found a 5-point IQ deficit in boys, but not girls. What was their overall? That's what their main objective was. What was our overall difference between fluoridated communities and non-fluoridated communities in the IQ of the kids that was measured at ages 3 to 4? There wasn't a bit of difference. In fact, in the fluoridated community, it was a little higher. No, that doesn't mean they got a 0.14% higher IQ point. There is no difference. Aberzulia in Spain did the same thing looking at fluoridated water versus non, came out very, very similar, very similar. In Canada, Deborah Dewey was another person looking at the studies that they looked at, and they said in their paper were making a point that there was IQ drops. When you looked at their overall, there was no difference between fluoridated and non-fluoridated. And a gentleman in 2024, Loch Doe in Australia, did the same thing, only he measured IQ at a more appropriate age, 3 to 4 years old, not knowing what ages they were measuring it at in the Canadian studies. You cannot, a new 3-year-old versus an almost 5-year-old, we all know how different it is, how much they develop and change. Dr. Doe measured it at ages that were appropriate, and there were no IQ differences between fluoridated and non-fluoridated communities. And a very high quality meta-analysis came out in 2023, which showed that water fluoride levels below 1.5 parts per million had no IQ differences. Above 1.5 parts per million, there was some association. We don't know at what point above that. The EPA lawsuit, that's kind of history now. The lawsuit, the judge said there was an unreasonable risk of fluoride in the water, but he did not conclude with certainty that fluoridated water is harmful. The judge is a judge. He used the National Toxicology Program report of over 120 times in reporting it, and he got it wrong because the National Toxicology report said on the 3rd page in bold, that was my highlighting, that it does not apply to water fluoridation, yet he used it in his judgment. No country in the world has stopped fluoridating their water because of the court case, because of the NTP analysis and meta-analysis, or the Cochrane review. No countries are doing this. Just a quickie on the NTP report. More than half the studies of the NTP report were published in low-quality journals. In the meta-analysis, over 70% were low quality studies. Australian studies, Spain, Sweden, New Zealand, looking at fluoride in levels in water naturally occurring at 0.7 parts per million, and those that study water fluoridation have not shown any association between fluoridated water and IQ or ADHD. Scientists around the world have studied this, the ones I showed you before. There's no convincing evidence that there's any effect on any health system in your body, including the brain. What is the one thing that we do see from fluoride in water at low levels? You'll see dental fluorosis, it's called, which is a mild change in the color of the tooth that is absolutely not anything that harms the tooth whatsoever. It is not causing pain, does not change the function. It's just a slight color change in the enamel. That happens in fluoridated communities and non-fluoridated communities because kids are swallowing toothpaste during those first 8 years of life. Like I said, when those enamel is developing, they'll get more fluoride incorporated. The two in the middle that are highlighted in yellow, those are what's called very mild to mild dental fluorosis. And it's just the little white marks on the edge of the teeth that you'll see. Moderate fluorosis happens when kids are swallowing toothpaste without supervision by adults or fluoridated mouth rinses, and severe dental fluorosis absolutely does not occur from water fluoridation. And in fact, the very mild and mild fluorosis and even some of the moderate wears off over a period of 4 or 5 years after the permanent teeth come in. This is the difference between a fluoridated community and non. Everything equal, not changing your diet, not changing anything with just having fluoridated water. The ones on the right could be my kids. They'll still get cavities. They'll just get smaller cavities and much less of them, much less severe. So what would you want to have? Do you really see white marks on those teeth? Now, these are blown up, dried off, and enlarged under a bright light in our offices. I'd rather take a little white mark on my teeth any day, which is that has been shown to have those teeth more cavity resistant than not. Fluoride additives have been said to be different in the additives that are put in the water than non. They are no different. There's only one fluoride ion. God did not, on the 8th day, come back and create another fluoride ion. Challenges have been made in U.S. courts now 109 times since fluoridation began to try and stop water fluoridation. Freedom of choice is one of the biggies right now. It has been heard in three court cases over the last 80 years, and it has never been determined that it is something that's taking your freedom of choice away. In fact, one case in particular, Quiles versus the city of Boynton Beach here in Florida, the judge summed it up nicely. He said, your water utility is bringing water to your faucet. When you turn it on, you have made your choice in using it or not. Now, people say, it's my choice, my body, why should I have to do this? Well, does a child get to decide where they're born into, a rich family or poor family? Do they get to vote? No, they don't get a choice in whether they get fluoridated water or not. So we're wanting to place ourselves above everyone else in the community and take something away from them. Our choice is get a reverse osmosis unit. It will remove almost 97% of fluoride from your water for about $230. And fluoride is not absorbed through your skin. There are those that will say it is. It absolutely is not. And a dentist sat in a tub of water with fluoride and actually tested it. And it was not absorbed through the skin. It was not a one that would have ever made it past human subjects. He did it on himself. Every leading medical and scientific group around the world supports water fluoridation. If you want to listen to just two, American Academy of Pediatrics, American College of OBGYN, they tell pregnant mothers to drink fluoridated water for the health of the mom, and for that babies should have fluoridated water to use to develop healthy teeth and to maintain healthy teeth that have come in. You are developing permanent teeth at birth. Permanent teeth are incorporating fluoride from the time you are born until the time they come in. It's absolutely necessary to have it the entire time. No medical or scientific organization in the world opposes water fluoridation. None. I'll end my presentation at that point, and we can go ahead to questions and answers.
Thank you very much, Dr. Johnson, for your review of this subject. We have several questions that we would like to ask you. And one of them is Miami-Dade recently voted to ban fluoride additives. There is a cost which was also a factor in their decision. Do you know of any studies that have done a cost-benefit analysis that compares the dollars saved by not fluoridating versus the future medical costs and value of health impacts?
The studies that I showed you where it showed the cavity rises in Calgary, the same thing happened in Israel, same thing happened in Juneau when they stopped fluoridating. In Juneau, they got one more cavity-related procedure per year in low-income children. That was from Medicaid data. There are huge increases. I showed you a 78% increase in general anesthetic cases in Calgary during the time that they had stopped. I did show that there were $32 per person saved in dental treatment costs per year when water fluoridation is in place, and adjusted for inflation, that's $43 per person. So yes, there are studies. I could go into it more, but yes, there are absolute savings. Miami-Dade, just like Orange County yesterday, the decision had nothing to do with money. It had nothing to do with science. It was people at the dais that wanted to vote fluoridation out. Pure and simple. It's never about science. It's politics.
Okay. We have several more questions.
Yes, ma'am.
One is, how does the process work to track the natural amount of fluoride in our water to determine how much to add? And how often are fluoride levels routinely monitored by any government agencies?
Great question. The fluoride level is measured where the water comes into the water plant. And that is looked at as is called the background level of fluoride. As I said, fluoride's in all water. So if it's too low, which almost all of it is too low, it's under the 0.7 parts per million. It's looked at as, say, in Florida, we had primarily 0.2 parts per million. So 0.5 parts per million is added to the level in the water to bring it up to 0.7. It's measured several times a day. There are fluoride meters that are in line in the pipes. There are those where you will still take samples and you'll measure them. The water operators do multiple times a day. That data is reported to the state on a monthly basis for every day of the week. It's reported to the state. And that data has been going to the CDC's Oral Health Division. And there is a website called My Water's Fluoride, which is one that you can go on and look at your city and your state and be able to see how much fluoride is in your water in a particular month. So it is very, very closely monitored.
Okay, thank you. There's someone that asked why you were saying that there's a 25% reduction in decay rates when the Cochrane review from 6 months ago said that that was not true. They had a different take on this than you did, and they stated that there was not the decrease in tooth decay. And this question also states that these results were confirmed by two huge studies in the United Kingdom, the catfish and the lotus studies. And he questioned your review of these numbers. Can you comment on those studies or this question?
Absolutely. And I know the authors of those studies. I have met them. I met them in person before in 2015. And I will tell you that the numbers that were used, what they actually said, there were modest cavity reductions. The issues with those studies, we have published with the British Fluoridation Society 2 papers on them, on the lotus and catfish. And so has authors here in the U.S. Academicians have looked at it. What they looked at was, is there a cavity or is there not a cavity? It could be a little hole, could be a tooth totally broken down to the gum line. That's a prevalence appearance. That's prevalence. That's looking at, is there a cavity present where they started fluoridation back versus the community that the area did not have fluoridation. Now, when you look at actual surfaces of cavities prevented, and that data was there, you were seeing about a 35% cavity reduction. So Anne-Marie Glenny, who was one of the primary authors on this, stated in an NBC News interview, she said that water fluoridation in contemporary studies absolutely is showing cavity reductions. And if you have water fluoridation systems in place, they call them schemes, do not stop them. The catfish study, they started back fluoridation with 2 water plants, fluoridating the water to this area. For 1 year, one of those plants was flooded in a major flood that occurred, could not operate. They continue to measure those kids as being fluoridated. Now, would we look at any study like that and say it's good? No, but we went ahead and looked at their data, and their data still showed cavity reductions similar to what we have here in the US and around the world. So the data on Lotus is flawed. I don't have time to go into it, but I'd be happy to give you the links to publications that we put together along with the British Fluoridation Society. And we also spoke to the authors of the catfish study, the primary investigator, and sorry, I forget her name off the top of my head. Michaela Goodwin was the primary author. We spoke with them about this. They're friends. They remain friends, even though what we printed and are in documents that got published in British Dental Journal showed that what they had said was not exactly right. Lotus, the catfish has never been published in any credible journal. It's only been filed with the country because they published it in England. I mean, they have to put it in the files, but it has never been published in a peer-reviewed journal, and likely never will be, because no journal would accept something where a plant was flooded for a year and you continue to study to measure the cavity reductions. That's a major flaw.
Okay. There's several questions relating to fluoride in dental practices. One of them is, how would you explain that fluoride in toothpaste dissipates after 2 hours, but fluoride in the water does not dissipate in 2 hours?
Oh, it does. No. Well, it is, you're drinking water through the day. You're eating foods that are made with water. So yes, are you eating at nighttime? Because I said continuous exposure to small amounts of fluoride are important, and that's what makes water fluoridation so important. Well, what happens at night? Remember I said that fluoride is in that sandwiched area between the plaque and your tooth, that plaque reservoir. Fluoride is also on our mucous membranes, our tongues. That mixes with saliva. That little bit of fluoride that comes out of those fluoride reservoirs mixes with saliva, and it keeps a low amount of fluoride in our mouths all day long. The big rise in fluoride, it gets up to 100 to 1,000 times the resting rate of fluoride in your mouth when you brush your teeth with toothpaste. That's excellent. It helps to drive more fluoride into your teeth, more into those reservoirs, but that falls off after about 2 hours. So it's that low amount that's constantly released into the saliva that is helping us have our major reductions in cavities.
Okay. Another question is, one of the participants said that her dental office had recommended to her as an adult fluoride varnish. And what's the benefit of fluoride varnishes for adult patients seeking dental care?
Please, if you don't get it recommended to you, and I've not had it recommended to me, I ask for it. I have crowns on my teeth. We're good at what we do, but where your crown and your tooth meet, there is a margin. It's not as smooth as what God made it to begin with. We'll get plaque collecting there, and I have had crowns with cavities under them, and I've had almost all of them replaced in the last 30 years. Now, what that varnish is is a very high concentration of fluoride in that varnish. The great thing about it is that varnish is like concrete on your teeth. It sits there and it drives fluoride into your teeth. You're not supposed to brush your teeth with toothpaste for a day. So it will drive fluoride more and more into the tooth surface, making it more cavity resistant. As the elderly, those varnishes are excellent. So is another product that has fluoride in it called slips my mind now. I'm sorry, but it's another product that's painted onto the teeth that is very, very helpful for elderly and those of us who get root surface cavities, which are devastating. We're good at putting fillings in, but trying to fill one about the back of your mouth in the root, they'll fall out. That's one of the biggest reasons adults, elderly, lose teeth.
Okay. Here's a question regarding infants. How much fluoride should an infant from birth to 6 months get before their teeth erupt? And how much, does anybody know how much bottle-fed infants are getting from tap water when mixing formula?
Oh yeah, yeah, we do. And yes, you develop your teeth starting at 6 months of age. I mean, starting at birth. They're already developing, your permanent teeth are, and is absolutely fine. The question comes around, why is it not recommended to start fluoride supplements until age 6 months? And the reason for that is that we have gone from starting them at 2 weeks of age. When I was in early practice, we are trying to stop some of the white marks on the teeth because some people say, oh, I don't want those on my teeth, if they can dry out enough that they can see it. So now it is recommended that you take them starting at 6 months instead of 2 weeks. And it's a lower dose until you get up to age 3. And then at age 6, it changes again and it stays at that level. You absolutely can drink fluoridated water mixed in with your formula, concentrated or powdered. That's where I did my area of research when I was in my residency. I will tell you that you don't drink a lot of water. Babies don't drink a lot of water. The point is, those that oppose fluoridation, is one size does not fit all. It's the same fluoride amount that you have as an adult that you have as a child. Well, we don't drink a gallon of water as an infant. You're drinking a low amount of formula. And that fluoride has never been shown to be problematic. Never. Again, the studies that have been done have been widely criticized and thrown out basically in the world of scientific review. So you can absolutely drink it. And as we get older, claims will be made. Well, adults, people who work out a lot, exercise, those that work in heat are drinking a lot of fluoridated water. You drink as much as you need. You'd have to drink 120 gallons of water in one setting to die from fluoride in the water. You die from water intoxication. It's not a problem.
Okay. There's a question about, how does ingested fluoride impact bone density? Is it true that it reduces bone density?
No, ma'am. Actually, your bone is more resistant to fractures with fluoridated water. Levels at 1 part per million, you have the lowest fractures of bones. When you stop water fluoridation and you get to around 0.3 or 0.2 parts per million, bone fractures rise. They're as high as they are if you had 4 to 5 parts per million in the water. Studies that have been done show absolutely no skeletal fractures, no hip fractures from fluoridated water. It does not occur.
Okay. And there's a question that there's a question, why 95% of the world does not fluorinate their water, and yet decay rates are the same worldwide?
Well, let me just put it this way. The World Health Organization recommends water fluoridation to prevent the most common and prevalent disease in the world. They recommend it. Now, why does 90% of the world not fluoridate the water? How much do you think of Africa and other countries that aren't even getting water that's clean? How could they even fluoridate their water? They don't even have access to clean water. So that's just a common way to try and say, well, everybody else is not doing it. Why are we doing it? Countries that don't fluoridate their water, like Mexico, is one that doesn't fluoridate their water. Areas in Europe don't fluoridate their water. There are reasons for that. Some areas have natural fluoride levels at the optimal amount. Others, they use fluoridated salt or fluoridated milk. They may not have the infrastructure, Mexico being a prime example. They don't have the infrastructure to deliver water that's clean and healthy. So they use fluoridated salt instead. In fact, there's as much fluoridated salt used in the world as there is fluoridated water. So there's where people will say only 97% or 97% of Western Europe doesn't use fluoridated water. No, not everybody does, but they have fluoridated salt, or they have focused programs of fluoride rinses and things like that for people. It does show, World Health Organization data shows that fluoride helped in toothpaste help cavity rates drop around the world. But when you looked at the data closer, when you looked at areas like in Ireland, which is fluoridated at the same percentage as the US is, the number of people, they had 25% fewer or less cavities than just with toothpaste alone. In other words, you had fluoridated toothpaste here in numbers of cavities, and then below that, when you added fluoridated water, you had an additional 25% cavity reductions. They work together. There's no doubt. Research continues to show that.
Okay, well, thank you. We're running close to time. There's a couple more questions. I hope that you'll be able to answer for us. You said that the Canadian author of a major study showing IQ reduction refused to share their raw data in a published paper. They answered that by saying it's not their data to share, it's the Canadian government's, and if you want it, you must go through them. What's your response to that?
Researchers at East Carolina University contacted the owners of that data. And the owner said, well, you need to have a panel of people. It's Mark Moss is his name. He's a researcher and academician at East Carolina University. So he assembled a panel, sent a letter to them. They said, no, you need these additional people. This went on for 2 years, 4 letters. The final one, when he had everybody put together that these owners of the data had said they wanted, they told him, well, we're not going to release it to you. And the second reason why they wrote was, you are on the scientific advisory committee for the American Fluoridation Society, and we will not release it to you. Seriously. He does not get paid anything. I do not get paid anything. He is a researcher, world-renowned, and it will not be released still. They even offered to go to Canada, sit there with the data, because they were saying, we won't let it go across state lines. Well, they went to Indiana University for Dr. Angelise Martinez-Meyer to analyze it in her lab, how much fluoride was in that urine. So there's some shadiness going on, but okay, we'll come up there and analyze it. They would not do it. They would not allow it. Set up a whole panel down here, never released it. But yet Dr. Christine Till, when she comes in and comments or interrupts or comes into communities like Green Bay, Wisconsin, and comments on politically to try and get them to stop fluoridation, as she has in Rutland, Vermont, I will say to her, if you have nothing to hide, show your data. It still has never been shown.
Well, we certainly appreciate your expertise. We don't know which way this is going to go, but it's certainly a contentious issue. I would like to ask this last question because I think it's an important one. Does the American Fluoridation Society contact public schools? Broward County Public Schools has a wellness committee. Does the society reach out to them?
We don't have the bandwidth to do all of the type of information or type of work that the person suggested, but the health departments do. There are programs in place that do reach out to kids. In my practice, when I was practicing, I would go to school, or so would my staff, and take toothbrushes, go and have our dinosaur with teeth and show how to brush the teeth, show the kids how to brush their teeth, talk to them about fluoride tablets because we weren't fluoridated originally in the water, talk to them about flossing their teeth. Absolutely. We all do things like that. And there's organizations that do that. Absolutely. Education is king, is number one. But let's look at it from the standpoint of our health. It's the most common chronic disease. People will say, well, it's a parental issue. You should, as a parent, you should be teaching your kids how to do these things. You should be teaching them how to brush their teeth, how to eat properly. If there was no sugar in our diet, we wouldn't have cavities. Well, there's a lot of truth to the sugar in the diet, but we wouldn't have cavities as much as we do. You still can break down carbohydrates like in potato chips and bread and turn it into sugar, and you can still get cavities. But obesity in this country is over half of our country. Obesity. If we can't control, and my sister has had issues with obesity her entire life, if we can't control it through diet, that's why drugs like Ozempic are now on the market, because diet alone is not changing it. People have problems. You can't stop it. So yes, education's important. The only place I know of where that works is in Scotland, where they have education in the classroom, and it's only for a certain age group. It's not for everyone. 4 times a year, they get dental checkups. They go through brushing every day. They use fluoridated toothpaste, and they are able to keep those kids from getting cavities. That's something that we don't have the money to do in this country. It costs about $130 per child per year. Where you're talking about fluoridated water in Miami-Dade was 32 cents per person per year. 32 cents to prevent cavities and save $32 pain and suffering and improve quality of life.
right, well,
Unfortunately, if we stop fluoridation in the US, we're going to see what happened around the world where it's happened. And we're going to have people in pain. We're taking ourselves back 100 years. I hope not to see it. I don't wish that on anyone. I have gone through it. I don't ever want to see that happen to anybody. I hope that
well,
we.
thank you so much for your time and for answering all of our questions. We really appreciate this
Thank you so
information.
much.
Thank you all. Thank you all for having me so much.
And
I appreciate it.
this recording will go on our YouTube channel, just so everyone knows.
Great.
Okay.
Thank you.
Thank you.
You bet.
Take care now.